Hello everyone, welcome back to my channel. This is Dr. Don. Today's topic is statin medications and type 2 diabetes. And really the reason why I'm talking about these together is for a couple different reasons. Number one, most of the time when your doctor diagnoses you with type 2 diabetes, almost immediately or within the first 6 to 12 months, they're recommending a blood pressure medication to protect your kidneys, and they're offering you or recommending you a statin medication, a cholesterol medication to help protect you from heart attack and stroke. So we're going to dive into this. There's a lot of information that we're going to go over because we're all led to believe one thing by the American Heart Association, but the reality and the truth sometimes can be completely different. So I'm here. I'm going to talk about research. With these type of videos, I'm not going to be using my opinion today. I'm not going to be giving you my opinion on many things. I'm really just going to tell you what the research says, what the science says, and really a little bit more in depth about our physiology and why the number one killer is still heart disease. The number one cause of heart disease is still type 2 diabetes. So I really want to dive into this because there's a lot of you guys watching this video that have diabetes. A lot of you have had family members that have gone through the disease process. You've seen them have heart attacks and strokes, open heart surgeries. And so, I don't want that to be you. And so I want to give you some free content today so that you can make the right choices for you. Okay. So, just a side note, listen, I do a lot of giveaways. I'm a very giving person. I like to give things away on a monthly basis. And so what I do is when I look at my YouTube channel and I look at my videos, I look at the people that are consistently engaging with my videos, consistently watching my videos, and those are the people that I choose to give away free food allergy testing or free immune panels or free dietary consultations. There's a bunch of different things I like to give away. So to qualify for things that I give away, number one, you have to subscribe to my channel. Number two, you got to like this video. And you have to put in a thought-provoking comment or question in the comment section below. And then, I want to see you consistently engaging in my videos. And so if you hit the bell icon, it's going to notify you when I put out new videos. And that'll just help you stay plugged into my channel. Not only so that you can be able to get a free gift, but also so you can continue to watch these videos, get value out of these videos, share them with your friends that need to watch them, and hopefully you can apply what I'm telling you and literally start immediately to improve your health. So, all right, diabetes and cholesterol. Typically what we see when you're diagnosed with diabetes, they tell you to lose weight, exercise, and improve your diet. As you know, that's pretty much the extent of the counseling that you get day one. And over the years, over your lifetime, over the disease process, that's pretty much the extent of the counseling that you receive. And most of the time, like I said, within 6 to 12 months, because of the negative impacts that high blood sugar has on the body, we go from one medication to several medications very, very quickly. In that regimen, it's a standard of care for you to be prescribed a cholesterol medication, also known as a statin medication, and a blood pressure medication or a diuretic, something to protect your kidneys, right? And so let's talk about a couple things. Number one, by taking statin medications, because there's a lot of people taking statin medications that are not struggling with diabetes. So the first thing I want to talk about before I go into the effects that cholesterol has on your body, the effects that cholesterol medication has on your body, I want to talk about some statistics. Because the statistics are, in both men and women, the number one killer in our country is heart disease. The number one killer in our country is heart disease. The number one prescribed drug in our country is statin medications, cholesterol medications. Millions and millions and millions of Americans are prescribed statin medications every day. Now, the belief behind these medications is that high cholesterol equals heart disease, heart attacks, and death. Now, the statistics are very clear. You can look up these statistics. The research is very clear that nearly half of the people that have had heart attacks, nearly half of the people that have had heart attacks have normal, which is considered around 200, or low cholesterol. Normal or low cholesterol. Let me say that again. Nearly half the people that have heart attacks have normal or low cholesterol. So if high cholesterol equals heart disease, heart attack, and death, why over half the people that are having heart attacks have normal or low cholesterol? So does cholesterol being high truly the reason why these people are having heart attacks, developing heart disease? I'm here to tell you, my opinion aside, no, that is not the reality. See, back in the 50s, a gentleman named Ansel Keys, he is a gentleman that came up with the theory that saturated fat equals cholesterol, high cholesterol equals heart disease, which leads to heart attacks and death. And so the studies began in the 50s. They really blew up in the 80s when Crestor and Lipitor came out, which are the two most popular diabetic drugs. They have different names nowadays, but the studies were very, very clear. There was a 1% difference in the people that had heart attacks for those that were taking a placebo pill and those that were taking a cholesterol medication. There was a 1% difference. Now, in the ads that they ran back in those days, they said that there was a 36% relative difference. It's a play of numbers. I can show you these statistics. I can show you the bar graphs that they used. And again, guys, there was just not a big difference. So there's not a whole lot of research done like that today because the American Heart Association wants us to believe that a high saturated fat diet is going to increase your cholesterol, which that I do agree with. Okay, that I do agree with. But high cholesterol equals heart disease and heart attacks is just not the case. See, there's been a lot of studies done. No, okay, I take that back. There's not been a lot of studies done. There's actually only 3 that I know of. The last one was done in 2003 called the Honolulu study. But these were studies that were done on families that had a condition called familial hypercholesterolemia. Now, this is a condition where people's cholesterols are well into the 300s. The reason why they didn't do many more of these researches is because the results were the opposite of what they want us to believe. The results are they had better mortality rate, less heart disease, more longevity, just a better quality of life with these people. And these were people in their between 60s and 70s, the prime age for heart attacks and strokes. And across the board, less heart disease, less heart attacks, better mortality rate. Okay, and so high cholesterol does not equal heart attacks, strokes, and heart disease. It just doesn't. Okay, doc, so okay, I understand that. If those were the studies, the results of those studies, so why is heart disease still the number 1 killer? So let me say this. And you've probably heard me, if you've watched my videos, you've heard me say this before. Regardless of what kind of doctor you are, whether you're a medical doctor, a pediatrician, an oncologist, a nephrologist, a neurologist, whether you're a chiropractor, a naturopath, a homeopath, a functional medicine doctor, the one thing, just about the only thing we all agree on is that inflammation drives all disease, including heart disease. See, the reason why nearly half the people that have heart attacks have normal or low cholesterol is because inflammation is the determining factor whether you're going to develop heart disease, heart attacks, and strokes. It is not your cholesterol levels. I know, but doc, the cholesterol is what's building up in the arteries that eventually occludes the artery, and that's what causes the heart attack. I agree with that statement. But how is it that if you have cholesterols in the 300s, you can be developing no plaquing and having no heart disease developing, but you can have cholesterols below 200, below around 150, and yet still develop heart disease and a heart attack and a stroke? And that is what I want to get into, because that is the truth that you need to hear. Because once you know the truth, then you can start taking the necessary steps to make sure that you don't become a statistic and you don't die from the number 1 killer here in our country. Okay, first let's talk about how a statin medication works. This is very, very important. And once you understand this process, that's why there's so many negative side effects when it comes to taking a statin medication. So a statin medication is called an HMG co-reductase inhibitor. Now try to say that 3 times fast, right? You don't need to remember that. I'm not going to quiz you at the end of this video, okay? But that's what the drug is. Now there's a pathway in your liver that makes cholesterol. Yes, your liver makes cholesterol. See, a lot of us are led to believe what goes in our mouth is the main influencer of our cholesterol levels. And that's just not the case. Diet is only responsible for 10 to 20% of the cholesterol in your body. 80 to 90% of the cholesterol in your body is manufactured by your liver, okay? And so what the statin medication does is it is an HMG co-reductase inhibitor. So that's an enzyme inhibitor that slows that pathway, which will cause the liver to produce less cholesterol. Now, who has heard of an enzyme CoQ10? CoQ10, coenzyme Q10, right? This is an enzyme that's essential for heart health. The same pathway that makes cholesterol in your liver is the same pathway that makes CoQ10. See, this is so important that in Canada, it's a law when a cardiologist prescribes a statin medication, they have to recommend CoQ10, even though it's a supplement, all right? Unfortunately, in our country, that's not the case, and not a lot of doctors are educated and know really how a statin medication is reducing your cholesterol in your body, right? And so because I dive deep into the physiology of our body, I know exactly how these medications are affecting your physiology. And if you start to take a statin medication, your CoQ10 levels are going to drop. Now, I'm taking a medication to reduce my risk of heart disease, but at the same time, I'm reducing an enzyme that is essential for my heart health. I know it's frustrating. A lot of people start to get upset when they hear this information. I'm not making this up. You can go find this on Dr. Google, right? Now, speaking of Dr. Google, if you Google statins and type 2 diabetes, you will see that a major side effect, and there's been a lot of research done, and I'm going to talk about one of these research articles, but there's been research that is very, very clear that there's 2 things that can happen when you take a statin medication. First and foremost, it can reduce the amount of insulin that the beta cells in your pancreas are able to secrete. Now, the pancreas is what secretes insulin. Insulin is a hormone, and its main job is to get the sugar out of your blood and into your cells, where your mitochondria, the powerhouse of your cells, can use that to make what's called ATP. That's just energy on a cellular level. This is how our body functions on a cellular level. When we start to dysfunction on a cellular level, that's when we start to get issues on a tissue level and an organ level, right? And so if we have dysfunction in the cells, it's only a matter of time before you start to elicit symptoms of that. So insulin's being produced by the pancreas. It's released into the blood. It gets the sugar out of your blood into your cells so your cells can utilize that glucose. Any extra glucose that's left in the blood, your insulin will store that as fat so that when you go into a fasting state, it can pull on that fat, convert it into energy, okay? So just a little bit of physiology on what insulin is. So there's been clear evidence that shows a statin medication over time can reduce the amount of insulin that your body produces. The second thing it does is it decreases the sensitivity that your cells have to insulin. All right, now, type 2 diabetes is a case of insulin resistance, meaning you're producing enough insulin, right? But you're not utilizing the insulin properly. And that happens for many other reasons. I have videos on my channel that explains that in more detail. Type 1 diabetes is a case of insulin dependence because you're not able to make insulin. So what I've seen with the clients that I've worked with that have been on statin medications for a long time, they have become insulin dependent type 2 diabetics, meaning they're dealing with insulin resistance, but their pancreas is also struggling to secrete enough insulin. And this is where we see where the oral medications become less and less effective over time. So regardless of what you're doing, you're still getting sugar spikes, your A1Cs are still high, and this is when your doctors start to talk to you about going on insulin therapy. I'm not going to get into my frustrations and my pet peeves when it comes to insulin therapy. I know why doctors do it. they get to a point to where they look in their tool bag. There's no more drug therapies. There's no more drug samples for them to use. Their only choice is to put you on insulin. I have videos on my YouTube channel, again, talking about insulin, the effects that it has on your body, and why it can really help your disease process progress very, very rapidly. So statin medications have been shown to decrease sensitivity to insulin and also decrease how much insulin is being produced, okay? So, with just that alone, there's also a lot of neurological side effects. There's a lot of liver side effects, dementia and Alzheimer's. There's just so many things, peripheral neuropathy. See, cholesterol is a vital nutrient. I don't want to get too far off base here, but cholesterol is needed. It's an essential nutrient in our body. And when you start to force our cholesterol levels down, a lot of issues start to happen. You need cholesterol to produce every hormone in your body, your sex hormones, your steroid hormones, your stress hormones, right? So when cholesterol starts to creep up in your blood, there is always a reason why your cholesterol is going up. And so to me, it's never made sense to just force it down, even with herbs, right? Obviously, I don't prescribe medications. I'm not a medical doctor, right? I do use herbs and I do use nutrients and diet and supplements and lifestyle to get patients the results that they get. But it makes no sense to me to just force cholesterol down instead of asking the question, why? Why is your cholesterol going up? And if you know what cholesterol is needed for in your body, then we just need to start looking as to why your body is increasing cholesterol. For example, if you go through a major stressful event in your life, your cortisol levels and your DHEA levels are going to increase. Your stress hormones are going to go up. Well, what do you need? What's a precursor to make hormones? Cholesterol. So your body's going to naturally increase cholesterol. You go to the doctor, cholesterol levels are up. Oh my gosh, we got to get you on a statin medication. So now you just hindered the body's ability to adapt to a stressful environment. Let's say a female gets a hysterectomy, a full hysterectomy, right? Well, now your body is naturally going to be depleted in hormones. So your body thinks you need more hormones, not because you had a major medical procedure done, but because you have low hormones. So what's your body naturally going to do? It's going to increase cholesterol, right? And again, I can go on and on of the different reasons why your body will increase cholesterol, okay? But my point is when cholesterol starts to go up, we don't just force it down with a drug. We don't just force it down with an herb. We need to ask the question, why? Okay. Now, let's talk more about what can I do to make sure I don't become a statistic and I don't go down the road that maybe my folks did, or maybe my siblings did, or my grandparents did. And it was just a matter of time before they started blood pressure medication, cholesterol medication. They were having strokes, mini strokes, and then major strokes. They were having, mini heart attacks and then major heart attacks, open heart surgeries, and eventually dying from one of those issues, right? What can I do to make sure I don't become that statistic? It's a very simple answer. We need to make sure that you don't have inflammation that's out of control in your body. Okay, doc, well, that's okay, but what do you mean by that? When I teach guys, I love to use analogies, okay? So we're led to believe that cholesterol just sticks to the side of your arteries. It eventually occludes the artery, stops blood flow, and now we have a stroke, a heart attack. And in the meantime, right, we've already got heart disease. We've been developing heart disease for years, and then it finally shows up in a heart attack. Or maybe, because you do your yearly physicals, your doctor caught it in time. And so you had, you got your arteries cleaned out, or you had a stent put in, but you did whatever so that it didn't eventually lead to a heart attack, right? But what can I do to make sure I'm not plaquing? How do I know if I'm plaquing or not? See, the basic testing you're having done with your overall cholesterol count, your LDL count, and your HDL count, it tells you absolutely nothing about your risk of heart disease. And this should upset you if you've been on medications for years. You're told you're doing the right thing because you're being lied to. I don't beat around the bush. I'm a straight shooter. It has nothing to do with your overall cholesterol levels. Okay, nothing. Now, LDL, it's what everybody calls the bad cholesterol. Well, I'm here to tell you, number one, LDL is not cholesterol, okay? And number two, there's no such thing as bad cholesterol. Your body makes cholesterol. Your body doesn't make anything that's bad, right? So LDL is considered bad cholesterol because if it's an unhealthy LDL, which I'll talk about, if it's an unhealthy LDL, that is what's going to cause plaquing. Why? Well, LDL is a low density lipoprotein, so it's a taxi cab. See, cholesterol is fat-based, your blood is water-based. So fat and water don't mix, so the fat's got to get inside of the low density lipoprotein, and that's what carries that cholesterol through your blood and reaches its destination to do all the things that cholesterol does for us. HDL, high density lipoprotein, the reason why they consider this good cholesterol is this is kind of the cleanup crew. So any unused cholesterol, it goes inside that high density lipoprotein, and that's the taxi cab to take that cholesterol back to the liver for degradation and to get rid of it, okay? And so that's why they call it good and bad cholesterol. Now, this is an analogy of what your doctor is doing when he tells you that a high LDL count equals risk of heart disease. So picture I've got a patient and they're standing on a scale, okay? Now there's a curtain between me and the patient, so I can't see the two patients. I can just see the number on the scale. And the number on the scale says 200 on both scales, okay? So by just looking at that number, do I know anything about the composition of the patient, about the health of the patient, about the body mass of the patient? Do I know anything? No, of course not, right? All I know is they weigh 200 pounds. Now I take the curtain away and I've got a 5 foot tall female and I've got a 6'2" foot tall male, but they both weigh 200 pounds. So can you see how the composition of the patients can be completely different even though they both weigh 200 pounds? Okay, I hope you're following along with me, right? So the overall LDL count, which your doctors are testing on you every time you get your annual physicals, every time they run that basic blood work, right, tells you absolutely nothing about the composition of your LDL particles. Okay, well, doc, why is that so important? Nobody's ever talked to me about the size of my LDL particles. Why does that even matter? I thought it was just, if I have a lot, it's dangerous. If I don't have a lot, I'm safe. And that's not the case, okay? So let's break this down. The inside lining of your blood vessels, okay? It's called your vascular endothelium, the very inside lining. This is the only lining that comes into contact with your blood. The analogy I like to use, it's like a tennis net, okay? It's like a tennis net around the inside of your blood vessels, all right? Now, this is not a tennis ball, okay? This is an apple, okay? But I didn't have a tennis ball today, so I'm gonna use an apple, okay? But for the sake of my analogy, let's picture this is a tennis ball, all right? So when your LDLs are made by the liver, they enter the bloodstream, a big, fluffy, healthy particle size. This is the way your liver makes them. Again, the liver doesn't do anything wrong. Your body never makes anything that is bad and unhealthy. So when it's made by the liver, it's a big, fluffy, healthy particle. It enters the bloodstream. Now, it's surrounded by a tennis net. And so as long as it stays the size of a tennis ball, it can't get through that tennis net. So it's going to travel through your blood vessel. It's going to reach its destination. That nutrient's going to be used by whatever tissues it's being influenced by, right? It's going to do its job. Cholesterol is going to do its job, okay? And then whatever's unused, the HDLs are going to grab it. It's going to travel back through the bloodstream, back to the liver, and it's going to get rid of it. Everybody's happy. The body's healthy. The job's been done by the cholesterol, by the liver, by the LDLs and the HDLs. Now here's the problem. And this is what causes heart disease. This is what leads to heart attacks and strokes. When you combine inflammation with your big, fluffy, healthy LDL particles, for the sake of the analogy, if you combine inflammation with the tennis ball, now you develop golf balls. And yes, this is a golf ball. So now you develop golf balls, okay? So now the golf ball moves through your bloodstream, and guess what? That golf ball slips right through that tennis net. And so what happens, the cholesterol doesn't stick to the inside lining of your blood vessel. It gets lodged between the vascular endothelium and that second layer of smooth muscle. And so over time, you get more and more buildup, right? It either occludes the artery or an unhealthy portion breaks off, right? Either way, it can cause a stroke and a heart attack, right? And so healthy, unhealthy. And let me ask you a question. How many of you watching this video, number one, has ever been talked to about this, or number two, has ever been tested? Hold on, you mean to tell me you can actually test for golf balls? Absolutely. Well, why aren't your doctors testing for golf balls? And I'm going to give you a very, very simple answer. It's not because they're not smart. It's not because they don't care about you guys. Okay? The reason why they don't test for golf balls is because a statin medication has zero influence on stopping a tennis ball, healthy, from becoming a golf ball, unhealthy. A statin medication has no impact on that. And so the reason why nearly half the people having heart attacks have low cholesterol is because they still have a bunch of golf balls in their system. Maybe not up over 200, right? But they still have golf balls. They still have golf balls. So it doesn't matter how much cholesterol you have. It matters, is it healthy cholesterol or is it unhealthy cholesterol? Because LDL doesn't equal unhealthy cholesterol and HDL doesn't equal healthy cholesterol. It's the size of the particles. What influences the size of the particles? Like I said in the beginning of this video, the one thing every doctor, physician, chiropractor, naturopath, homeopath, every doctor agrees that inflammation drives all disease, including heart disease. Abnormal amounts of inflammation drives the golf balls, which increases plaquing, which increases risk of heart disease, heart attacks, and strokes. So for those of you that are taking a statin medication, thinking you're doing the right thing, you might want to find a doctor that, number one, is willing to check, do we have a bunch of golf balls or do we have a bunch of tennis balls? Number two, if we do have a bunch of golf balls, which a lot of you do, that's why it's the number one killer in our country. Because everybody's walking around with a bunch of golf balls plaquing like crazy. Why? Because we're all walking around with a bunch of inflammation. So you need to find a doctor that will test particle sizes and that will test inflammatory levels. Okay, doc, well, what if I do have a lot of inflammation? Well, what if I do have a lot of golf balls, a lot of small particle sizes? Well, we need to put together a program to address those issues. And see, every single one of you watching this video, you can have abnormal amounts of inflammation that's driving your heart disease for different reasons. It could be something like emotional stress. It could be GI infections, hormone imbalances, autoimmune diseases, food allergies, right? The list goes on and on and on and on and on. A statin medication does not reduce your risk of heart disease, heart attacks, and strokes. And on the other side of the token, statin medication increases your risk of developing type 2 diabetes, developing neurological disorders, right? And many, many other issues. Now, I'm not here bashing the medical world. I'm not here bashing your doctors. I'm not here bashing the medications. But I am here telling you that the approach should never be to just bully physiology with a drug or bully physiology with an herb in order to make the numbers on a lab normal. Because what is normal? Is 200, the number 200, is that a normal cholesterol level? The answer is it could be completely different in everybody. All right, guys, as always, if you got some value out of this video, definitely like this video. And like I said at the beginning of this video, I love doing giveaways. And so if you like this video, if you put a thought-provoking question or comment in the comment section, those are the type of people that I like to give away things to, all right? Also, subscribe to my channel. And, you know, to be consistent with watching videos, if you hit the bell icon, it'll definitely notify you when I put out extra videos. And listen, If you're to the point to where you're so frustrated, either you're on statin medications, or you have heart disease, or you're a full-blown diabetic, for whatever reason, if you feel like you want some advice, if you feel like you want to jump on the phone with me, I'll include my link in the comments section of this video, and you can jump on the phone with me for a free 30 to 45 minute call. We can sit down, discuss your history, and see if it's something that I can help you with. But listen, you guys have an awesome day. God bless. Bye-bye.